Welcome back to Easy Health and Fitness, also known as Torah Health and Fitness. Have you been taking your daily vitamin D? We've spoken about it many times. It's one of the easiest things you can do and cheapest things you can do to boost your immune system. The Chazal talk about how the sunshine promotes good health. The doctors talk about it and how we don't get enough sunshine these days to give us the vitamin D we need, most of us. And I actually have not yet met a doctor who does not recommend supplementing vitamin D as a standard for all their patients. I'm talking about GPs. The other day, a Talmid Chacham, fairly well-known, challenged me on the concept of the mitzvah of exercise. He said to me, Chazal say you should walk 4 steps after a meal. It doesn't say you should go for a walk. Who am I to respond to such a challenge from such a Talmid Chacham? All I can say is I know that, as a matter of fact, a recorded history, that the Brisker Rav would walk daily, that Rav Yaakov Kamenetsky exercised regularly, that Rav Ruderman was known to take long walks and reportedly had a stationary bicycle in his basement with a book stand, a stender attached. Rav Yehuda Davis required his students to exercise every day as Talmidim in the yeshiva. Rav Shimon Schwab walked regularly. Rav Victor Miller required his Talmidim, he told them they should be exercising or walking at least a half-hour a day, and he himself took a daily 90-minute walk. Rav Ari Yosef took an exercise walk for about 30 minutes a day, and so on and so forth. There's even others, but I think that's enough evidence that if you don't trust, you don't like my reading of Chazal, expanding Chazal to apply to, beyond 4 steps after a meal, take it from the Gedolim, who themselves found that walking daily or some sort of exercise was important enough for them to take the time to do. I'd like to talk about a value that's in the Gemara, in Chazal, that I'll call personal hygiene. Personal hygiene, it's like health in general. Everybody knows that being healthy is common sense. The whole purpose of this series that I'm doing in this book, Body and Soul, and the website, torahhealth.org, is to explain and show how keeping healthy is more than common sense. It's actually a mitzvah, and what are the parameters of that qua mitzvah, as a mitzvah. What turns a common sense activity into a mitzvah? And I think the simple answer is it could be the same action, right? And for one person it's a mitzvah and the other it's not, because it all has to do with what's going on up here, how it's done, what kind of kavanah one has when doing this action. And here's a great example. It says in Gemara, Shabbos, a person must wash his face, hands, and feet each day in honor of one's Creator, as the pasuk says, quote from Mishlei, from Proverbs, he made everything for his purpose. That's very interesting. It's not just telling you to be cleanly, it's not just telling you to clean your face and hands and feet every day. It's saying to do it with a specific kavanah for honoring God who made you, okay? Being cleanly is important, but more important is being cleanly for a higher purpose. This is how one actualizes his B'Tselem Elokim. You were made B'Tselem Elokim as a potential, but it's only a potential until you actualize it. Otherwise, you're essentially a behema. To turn behema into B'Tselem requires kavanah, requires doing something with a meaningful purpose. look, I think what the Chazal are saying even beyond that, even if your face and hands are clean, this is an opportunity every day to elevate yourself, elevate your goof, elevate your body to a higher purpose, which is B'Tselem Elokim, living in the image of God. This applies as well to the teeth. It says in the Gemara, this is in Brachos, Rav Mari said in the name of Rav Yochanan, one should not eat lentils every day because they cause a bad smell in the mouth. Well, I think the Talmud's issue is obviously not lentils per se, it's the halitosis that we are meant to avoid, avoidable halitosis. Even with our modern day dental care, which would be a marvel, a miracle to any time traveler from the ancient world to see what we can do, what our dentists can do now and our orthodontists can do. Even so, with all this we know that people can suffer from halitosis, and one of the causes of that is food, eating food. And in order to remove that halitosis, or to avoid it, one needs to remove the food from one's teeth, which means, of course, brushing and flossing. Maybe flossing should come first, flossing and brushing every day after every meal. I know it's hard to believe, but there are some people who do not floss their teeth every day. But that is what I think is the extension of what Chazal are saying. When Chazal say don't eat lentils, they're not saying simply to avoid halitosis causing foods. They're saying do what you need to do to avoid a bad smell about your body. And today we know that that involves as well flossing your teeth every day. Certainly after, once a day, but preferably after every meal. Food stuck in the teeth is a major cause of bad breath. Now, I've spoken to dentists who tell me that most of their patients skip flossing on Shabbos and holidays. That means you could be going 24, 48, even sometimes 72 hours without flossing your teeth. Ooh, that's probably not the ideal practice. That means there's food stuck in your teeth for up to 72 hours. Doesn't sound like that's fulfilling what Chazal are telling us to do, which is to avoid, when they say avoid eating lentils. So, what do you do about the bleeding issue? Well, it turns out if you really get yourself to floss every day, your gums will stop bleeding, So you don't have to be a gum bleeder. You just have to get in the habit of flossing more often, and the bleeding will cease and you won't have that issue. And if this sort of spiritual approach or Talmudic approach to inspire us to keep our mouths as clean as possible is not enough for you, how about a little bit of medical information we have? It turns out that people who don't floss and brush their teeth properly have a higher risk for, obviously for gum disease, but also for rheumatoid arthritis and Alzheimer's disease. How is that possible? It sounds very unlikely, right? Well, it turns out that these latter two diseases, rheumatoid arthritis and Alzheimer's, are both can be caused by P. gingivalis, which is the bacteria which causes gum disease. The same bacteria that causes gum disease has been found in significant quantities in people's brains who have Alzheimer's, and in the case of rheumatoid arthritis. So that bacteria staying in your mouth, apparently the theory is, can enter the bloodstream and then go to other parts of the body. So there should be a real medical motivation, a health motivation to floss your teeth daily, if not more frequently than that. And we have a Torah spiritual mandate to keep our mouths clean. And maybe we'll wrap with that, and maybe just a practical tip. Brushing on Shabbos. Can you brush on Shabbos? Sure. Use a dry toothbrush, or what's now called the Shabbos toothbrush, with bristles that are designed for use on Shabbos. What is called good brushing, say the dentists? 20 seconds per tooth. So it takes a few minutes. So what if a person's so busy, they really literally only have time to brush and floss properly once a day? When should they do it? Probably before going to bed, because then you're lying in bed for hours and hours and hours and hours, so you don't want that bacteria to be accumulating and multiplying. Some health tips, some spiritual tips. As always, I wish you and your family to be gesund.